In this high topic module, we are going to learn about a very important topic, aphasias. Now, aphasias have been frequently asked in the examination where they have given you clinical, synopsis, and you have to been asked to identify what kind of aphasia it was. So, my idea will be in this lecture not only to tell you about various different types of aphasia, but take 8, 10 clinical questions which have been asked in the various examination on aphasias, and together we will try to work out which kind of aphasia was there in the examination. So let's start with the definition. What is aphasia? So aphasia is any disorder of speech. So any disorder of speech is called as aphasia. So what is speech? So when we define speech, it is ability to understand and express in written or verbal means. So this is very, very important, and this is where I want your attention, that it is both ability to understand as well as express which constitutes the speech. So there are two components to speech, understanding and expressing. Before I go ahead and tell you about different types of aphasias, let's quickly look at this particular diagram, because that will help you understand which areas of the brain are impacted and what kind of anomalies we will find or clinical features you will find. So this we know is a visual cortex. This we know is an auditory cortex, and both visual and auditory cortex give their input to this area. This is the sensory input area of your speech, and this area is called as Wernicke's area. Okay. Another area, so this area will, once it has received all the sensory input, it will convey to this motor area of the speech. And this area, this motor area, is called as Broca's area. And once Broca's area has got the message from the sensory input, that is Wernicke's area, it will further give it to the motor cortex for the execution of the, if the person has to speak, the motor cortex will relay the impulse to the muscles of speech. What connects this Wernicke's areas and Broca's area is also very important. It is called as arcuate fasciculus. Okay, so it is called as arcuate fasciculus. Now here I want you to understand that any lesion of Wernicke's area will lead to something called as sensory aphasias. What are sensory aphasia? Which means the person's ability to comprehend, okay, because all the sensory input is not able to comprehend. So sensory aphasias. Any disorders of Broca's will lead to motor aphasias. What is motor aphasias? He is able to understand, but he is not able to speak out. And we will see various different types of motor aphasias. And if there is a problem in the arcuate fasciculus, so this is a very interesting, this is called as conduction aphasias. Here the person is able to understand also and speak also. But if the coordination between understanding and speaking is, kind of altered. So we'll look into details of different types of, aphasias. But here I just wanted to have your clinical anatomy knowledge, so that when I talk about different types of aphasia, you are able to relate. So when I talk about different types of aphasias, let's understand how do we approach whenever a patient of aphasia comes, on whenever you get a clinical case on aphasias. So when I talk about aphasia, the first thing I want to see is the speech output. So there can be two possibilities. There is a non-fluent aphasia or fluent aphasia. So what does we mean by non-fluent aphasia? Which means the output is not, the patient is not able to speak. Okay. And in fluent aphasias, the patient is able to speak. Okay. So once we have seen that if the patient is able to speak or not able to speak, further if the patient is not able to speak, there can be two scenarios, and this is related to the comprehension part. So the comprehension can be preserved or the comprehension can be poor, which means in this case, the patient is able to understand, but he is not able to speak out properly. Here, the patient is not able to understand and he is not able to speak out. Okay. So, in this category, non-affluent preserved category, we have got two different types of aphasia. One is Broca's aphasia and second is transcortical motor aphasia. So in both these aphasias, the patient will not be able to speak out. The speech will be labored. He will be speaking very short sentences. Okay. So, but their ability to understand whatever instruction you are giving, whatever question you are asking is intact. Okay. So how do we differentiate between both of these? So remember, repetition. If you give a word and ask the patient to repeat it. For example, you say that, say, this is pen. The patient will be able to repeat without any difficulty in transcortical motor aphasias. But repetition is grossly, not there when you talk about Broca's aphasias. Okay. So grossly affected repetition in Broca's aphasia, but in transcortical aphasias, repetition is intact. But the patient is able to repeat. When we talk about poor, so the person is not able to understand and he's not able to speak. So this comes under global aphasia. Global aphasia means when you talk to him anything, he's not able to understand, and also his speech output is impaired. Another condition is called as mixed non-fluent aphasia. Okay, so you can consider this mixed non-fluent aphasia is something between Broca's and global aphasia. So he has motor, he's not able to speak properly, but he's able to understand something. Not the understanding is not completely lost as in case of global aphasia. He's able to understand some point, but his speech is not very fluent. Okay, so these are the four different types of non-fluent aphasias. Now, I'm going to give you clinical cases which will make all these different types of aphasia much clear. But just let's have a quick, understanding of different types of aphasia. Now, when we talk about fluent, so in these cases, the patient is able to fluently talk. But when we talk about, in these cases, about understanding, so understanding can be preserved or understanding can be poor. So the first example of understanding poor will be Wernicke's. What happens in Wernicke's? So here the patient is able to speak. He will be speaking left, right, anything. It will be like a word salad, but most of his speech will not make any sense. Also, when you talk to him, it will feel that he is not understanding you. He is not able to comprehend. So this is a kind of, remember, a sensory aphasias. Okay, sensory aphasia. He is not able to understand, but he will be able to, because the Broca's area is not impacted. He will be able to speak. So he will be speaking lot of nonsensical things, but very fluently. So this is your Wernicke's. In Wernicke's, there is a second criteria, that is called as transcortical sensory aphasia. Okay, transcortical sensory aphasia. Again, very similar to Wernicke's, but the only difference between these two will be repetition. Like in this case, transcortical motor aphasia, the patient was able to repeat properly if you say him a word. Here also, the patient can repeat words or sentences exactly as you say without even understanding them. In Wernicke's, he will not be able to repeat it. Okay, so this is very important. How do you differentiate between Broca's and transcortical? How do you differentiate between Wernicke's and transcortical sensory aphasias? Okay, so in transcortical sensory aphasias, if you tell the patient any word or any sentence, he will be able to repeat it exactly without understanding. So understanding is lost here in both these cases. But in Wernicke's, he will not be able to repeat it also. If you tell him to repeat something, he will not be able to repeat. But in transcortical sensory aphasia, he will be able to repeat. Let's talk about condition when his speech output is fluent and his understanding is kind of intact. So here we have got two cases. One is called as conduction aphasia. So in conduction aphasia, what happens? And very interestingly, the patient is able to understand everything. The patient is able to communicate his thoughts clearly. But when you ask him to repeat, he will not be able to repeat. So if you ask him, if he is talking spontaneously, he will be able to convey his ideas in a very, very fluent manner. If you tell him something, he will be able to understand it. But if you ask him to repeat, this is a pen, he will not be able to repeat it. Very, very interesting. Also, in such patients, he may, something called as, he will paraphrase. So, spoon, he will say it soon. So, he will get confused between similar words. And this is, remember, I told you about this arcuate fasciculus. So, if there is a lesion of this arcuate fasciculus, then you have conduction aphasias. Okay. And the last in this is basically what we call as anomic aphasias. So again, the patient is able to understand everything, speak properly, but he forgets name. So, in various movies also you might have seen that, "Arey, usko kya kehte hain, kya kehte hain?" So he will keep forgetting names. He will not find exact words. So his fluent will be output, but he will, kind of be fending for words. It's like the word is on the tip of his tongue, but he's not able to come out with it. So this also comes under conduction aphasias, right? So this is a broad classification of different types of aphasias. Now, your understanding at this point may not be very, very clear. That's why I have come with around 8-10 clinical cases where we both will try to work. So let's look at the first clinical scenario. So here a 65-year-old man with 2 weeks post-stroke speaks slow, labored phrases. So this is fluent or non-fluent? So remember, this will be non-fluent type. Okay. Mostly using key nouns and verbs. He seems frustrated as he knows what he wants to say, but he struggles. So his understanding is preserved. Okay. Understanding is preserved. So if his understanding is preserved and he non-fluent, however, he generally understands what the therapist gives simple instruction. So this can be Broca's. Okay. It can be transcortical motor. Okay. But how do you differentiate between both of these? It is primarily differentiated with his ability to repeat. Okay. So this is a motor aphasia. Okay. Motor aphasia. It can be Broca's, it can be transcortical motor aphasia. And the way to differentiate it, which is not mentioned in the question, is when, it is given if he is able to repeat words or repeat sentences or not. If he is able to repeat words and sentences, it will be transcortical. If he is not able to repeat words and sentences, it will be Broca's. Let's look at another clinical scenario. A 59-year-old woman produces continuous stream of words at normal rate. Much of what she says seems off topic or made up. She appears unaware that her speech makes little sense. So she is making continuous stream of words. So this is a fluent aphasia. Okay. But her understanding is poor. Okay. So there can be two things, either Wernicke's or transcortical sensory. So both of these are sensory aphasias. Her family notes that she often cannot even follow simple spoken commands. So it can be both. So we are looking at any sensory aphasia. Again, how do you differentiate if it is a Wernicke's or a transcortical sensory? Is primarily knowing if the person is able to repeat words or not. If he is able to repeat words even without understanding, then it is transcortical. If he is not able to repeat words, then it is Wernicke's. Let's look at another clinical scenario. A 72-year-old man attempts to speak, but only can say a few automatic phrases and often resorts to gestures. He also seems to be unable to comprehend basic spoken air. When asked to repeat simple word, he cannot do that. So there is, non-fluent. Okay. And also his understanding is completely lost. So this probably is a case of global aphasia. Global aphasia. Okay. Let's look at another clinical scenario. A 55-year-old woman speaks relatively fluent sentences and understands well. So her fluency is normal, her understanding is normal. okay, but has significant difficulty finding the right words. She frequently circles around the word. So, clear-cut example of anomic aphasia. So, fluent in understanding, fluent in speaking, but not able to find the correct words. That is called as anomic aphasia. Let's look at another clinical scenario. A 70-year-old man can understand spoken language quite well. He struggles to get word out smoothly, but speaks haltedly. Okay. Interestingly, if someone speaks a sentence to him, he can repeat back clearly, accurately, even though he cannot produce a spontaneous speech. Okay. So his understanding is preserved, but fluency is here. So this is non-fluent type of aphasia, motor. But you can see he is able to repeat sentences very easily. He is not able to spontaneously, you know, produce a speech, but he is able to repeat here. So this is a very good example of transcortical motor aphasia. Clear? So so it's a motor aphasia because he is not able to speak, but his understanding is intact. Okay. So there can be only two possibilities: Broca's and cortical motor aphasia. Because he is able to repeat properly, then it is transcortical motor aphasia. Let's look at another clinical scenario. A 62-year-old woman who had a stroke is able to produce fluent speech. But when asked to repeat simple words or sentences, she stumbles and cannot accurately respond to them. She understands what is said and convey her own ideas, but repetition is markedly repeated. So first of all, is it fluent or non-fluent? So definitely it is a fluent. Now in fluent, her understanding is, intact. See, her understanding is intact. So when understanding is intact, then you will have, this is a clear-cut example of conduction aphasia, because she is not able to repeat. So she is able to understand, she is able to speak, okay, fluently, but she is not able to repeat properly. So this is a classical example of conduction aphasia. Let's look at another clinical scenario. A 68-year-old man speaks effortlessly with normal intonation, but his sentences are full of nonsensical words and irrelevant phrases. So this is fluent aphasia with, despite his fluently, he cannot follow instructions or match simple object to pictures when asked. So understanding is clearly impaired. So again, this is a kind of sensory aphasia, can be Wernicke's and can be transcortical sensory aphasia. Now, how do you differentiate? The ability to repeat. So they have not mentioned anything about the ability to repeat. If the person was able to repeat normally, even though he is not understanding that, then the diagnosis will be transcortical sensory aphasia. If the person is not able to repeat, then it will be Wernicke's. Let's look at another example. So I'm giving you all these examples so that you become very, very comfortable with different clinical scenarios. A 60-year-old woman tends to speak very less with great effort. She can understand short sentences but struggle as they become longer and more complex. So her fluency, so this is non-fluent. Understanding also is decreased but not completely lost. So we don't have a global aphasia. This is what we called as mixed non-fluent aphasia. Remember, I told you it is something between global aphasia and Broca's aphasia. Okay. So not able to speak, understanding is preserved, thoda sa, but not completely understanding. As the sentences become complex, the understanding is greatly hampered. So this is mixed non-fluent aphasia. Let's look at another clinical scenario. A 73-year-old man has fluent speech and often sounds like real world strung together. Okay, but the meaning is not coherent. He has great difficulty in understanding spoken language. Surprisingly, he can repeat back complex sentences almost perfectly. So sensory aphasia, but repetition is proper. So we will have transcortical sensory aphasia. Why not Wernicke's? Because he is able to repeat. If he was not able to repeat, then it would have been Wernicke's. Let's look at another clinical case. A 66-year-old woman suffered left hemisphere stroke. She now speaks in slow, broken phrases and has trouble initiating speech on his own. However, when her therapist says something for her to repeat, she can do it here. So repetition is preserved. Okay, so this is non-fluent. Understanding is preserved. Okay, and repetition is preserved. Okay, so all this, this will be a motor aphasia, transcortical motor aphasia. Okay. Let's look at another clinical scenario. I'm giving you so many clinical scenarios so that once you are done with this lecture, you will properly, you can read a clinical scenario and tell what kind of aphasia is this. A 58-year-old man, speech is severely limited to a few stereotypical utterances he cannot understand, okay, cannot reliably name everyday object. So this is a clear-cut example of global aphasia. Okay, understanding is impaired, speech is impaired, ability to speak is impaired, global aphasia. Let's look at another clinical scenario. A 64-year-old woman with normal articulation fluency cannot seem to name form and object even though she knows what they are. She understands when people speak to her and can repeat words spoken to her. So this is called as exactly anomic. The only ability to name, now objects or find the correct word is missing. Otherwise, her understanding is good, her fluency is good. Let's look at another clinical scenario. A 71-year-old man talks a lot smoothly, but his speech is filled with incorrect words, does not respond appropriately to questions. So, understanding is impaired and struggles to understand what others say. But when asked to simply repeat a phrase, he can do it accurately. So, again, sensory aphasia, transcortical sensory aphasias. So this brings us to the end of this lecture. I have tried to give you an understanding of the anatomy. So what are the sensory inputs from the auditory and the visual cortex? They go to the sensory area of the speech, that is Wernicke's area. From Wernicke's area, all the input will be taken to the motor unit, that is the Broca's area, through arcuate fasciculus, and after that it will be converted to the motor cortex. So this is the pathway, anatomical pathway. And if there is any any impairment at the level of the sensory, you will have sensory aphasias, you will have motor aphasias if Broca's area is involved, and you will have conduction aphasias when the arcuate fasciculus is hampered. So these are, yeah, and then I have taken through a lot of clinical cases, actual cases which have been asked in the examination, so that you can get a hang of what kind of aphasia was asked in the examination. So hope this high topic was very, very helpful to you, and make sure that you are connected on with me on YouTube, on various social media channels, so that whenever I create such kind of high topics from which every year, at least 70-80% of the questions come from these high topics, you are able to, clearly get them right with full concepts and full confidence.